What's got you so worked up? Let me guess. Caught a captive but couldn't keep that creature in their cage? Morsels keep making tracks before you can make them a meal? Nevermore! What? Paralysis is the answer to your problem. Aha! I see you there, proudly preparing that pernicious potion. But wait, not so fast. If you aren't careful with that concoction, you might end up with a corpse gone cold, long before you can cook him in your kitchen. So, don't move a muscle, my lady of maladies. Don't even breathe. And I'll show you what really happens when you press pause on the protagonist.
Hi, I'm Matt Digman.
And I'm Roddy.
We're the authors of The Dark That Dwells, our debut space opera novel, and the first installment in an expansive new series that was released on July 10th, 2020.
If this is the first video you've seen of ours, allow us to welcome you to our ongoing series, Doctoring the Books.
Here, we share our knowledge and experience as physicians and writers to help you add some realism to your works, specifically from a medical or scientific standpoint.
On today's episode of Doctoring the Books, we're going to show you how to kill your characters with paralytics.
This video contains information relating to the attributes of potentially deadly toxins and medicines. The purpose of this presentation is to show you how these toxins might be used by fiction writers on fictional characters.
By no means do we advocate for the use of these drugs on living persons, except by trained medical professionals in treatment of a medical condition. The information presented here should never be used to harm anyone or be considered educational in that regard.
Now, that being said, enjoy! The term curare refers to a number of chemicals originally used by indigenous peoples of Central and South America to paralyze prey during hunting, or, less commonly, other humans.
These chemicals have varying potencies when it comes to paralysis, but today we'll focus on the most notable form, D-tubocurare, and we'll just call it curare for simplicity's sake.
Historically, the original users of curare would boil the bark of the source plant, creating a thick paste. This could be applied to arrowheads or darts, which would then be used to penetrate the victim's muscle or vein and cause paralysis within minutes, leaving them unable to escape, succumbing to their respiratory paralysis.
Today, we use medicines like curare every day in the emergency room and operating room to induce paralysis on purpose, usually when we're intubating a patient to help them breathe.
It also keeps patients still during procedures. These man-made derivatives of the natural variants have well-developed profiles and predictable effects, and many of them have antidotes if needed.
Curare is an example of a family of substances that act as non-depolarizing neuromuscular blocking agents.
Say that 5 times fast.
Simply put, this means they interfere with the communication of signals from nerves to voluntary muscles, leading to varying degrees of paralysis. In general, they only affect the muscles we use to move and breathe, not the muscles of the internal organs, such as the heart. So, if someone were to artificially breathe for the victim, they would survive until the effects of the drug wore off.
Normally, a chemical called acetylcholine travels across the gap between the nerve terminal to the muscle and stimulates contraction. Neuromuscular blocking agents like curare get there first and block acetylcholine, sort of like stealing a parking space in a crowded lot. Curare doesn't actually do anything once it's there, it just sits there smugly.
The mechanism of the antidote for curare goes back to blocking this blocking effect.
Continuing the analogy of the parking lot, the way to stop curare from rudely stealing a spot would be to have more acetylcholine molecules there, jumping in before curare has the chance. It's all about competition. An example of a medication that might do this would be physostigmine, derived from the calabar bean. By keeping acetylcholine around longer and preventing its normal breakdown, physostigmine makes sure there's plenty of acetylcholine present to grab all of the spots before curare can.
So how could curare or something like it fit into your story?
Imagine you have a dastardly villain, backed into his secret laboratory by a pair of heroes intent on apprehending him and bringing him to justice. During the struggle to capture him, one of the heroes is caught by the miscreant instead, and he puts a needle to her neck. The villain reveals that soon she will be poisoned, and if her companion doesn't breathe for her, it will be her undoing. The poison will fade, but not before she asphyxiates. "Come after me," he says, "and she will perish." The villain poisons her and makes his escape, leaving the unaffected hero to breathe life-giving air into her lungs. By the time she recovers and her chest begins to move on its own, the scoundrel is long gone.
The next time their paths cross with a nefarious fiend, they're prepared, armed with a magic bean given to them by a wizened wizard. They each consume half before confronting the villain. When he tries his trick again, he's pursued by the hero, who's confident his companion will recover much faster this time, long before she could suffocate from the villain's dastardly deed.
So what's unique here? Well, the temporary nature of the paralytic and the fact that the characters could pre-medicate against it with the antidote, the Calabar bean. And just like we do in real life, have someone breathe for your character and you can successfully pull them back from the clutches of death.
Gelsemine is an alkaloid molecule derived from the plant Gelseminium elegans, a plant known in some areas of the world as heartbreak grass.
Extracts of the plant have been used as a treatment for migraines, neuralgias, rheumatism, and other minor conditions for several hundred years. But for everyday medical uses in the emergency room, it doesn't really have a role.
Gelsemine acts as a competitive agonist of glycine receptors on muscle tissue. This means that it jumps in line to get to the glycine receptor before glycine can. But unlike our previous example of curare, where curare would jump in line then do nothing, Gelsemine does what glycine does, only stronger.
What does glycine do? It downregulates muscle activity. As Gelsemine jumps in and overdoes it, it causes too much relaxation, leading to paralysis.
In general, overdoses will cause depressed respirations, tremors, paralysis, convulsions, urination, defecation, retching, and increased salivation. Unfortunately, there isn't really a cure, though gastric decontamination and medicines or toxins with opposite mechanisms could theoretically be used to counter its effects.
So how could Gelsemine or something like it fit in your story?
Picture a family living on an expansive farm. Life is idyllic for them, and they have everything they could ever want. Enter a property tycoon who makes his fortune buying and selling land. He knows a major business is set to move into the area, and securing housing for all of its employees will be critical.
He surmises that the family's picturesque property would be ideal for a suburban setup. He also surmises that developers will want to buy the land for exactly that purpose. So, he decides to buy up the land first, then sell it to a developer for top dollar.
But the family is happy and refuses to sell, no matter how often he approaches them or how inflated his offers grow to be. He's frustrated beyond belief, knowing the purchase and sale of that land would set him up for life. So instead, he turns to death, deciding to kill the uncooperative family.
He studies them carefully, noting they live off the nutrients gained from harvesting their own meat, milk, and honey. This gives him an idea. He sneaks onto their property, planting a certain deadly plant near the beehives the family maintains. The bees then use nectar from the lethal plants to make honey. Before long, the family is found dead in a horrible state, seemingly having suffered and suffocated from some unknown toxin. Free of any sort of guilt over their deaths, the tycoon purchases the land at an auction, rubbing his hands together in terrible glee.
In this grim little tale, the villain took advantage of Gelsemine's harmless appearance and the bee's natural instincts, making them unwitting accomplices in his dark deeds. In real life, accidental ingestions have occurred when people mistake Gelsemine for honeysuckle, so this isn't too far-fetched of a situation to fictionalize. Coniine is an alkaloid toxin produced in various amounts by poison hemlock, yellow pitcher plant, and fool's parsley.
The molecule is present in most parts of the plant, especially in the seeds. Ingestion causes ataxia or difficulty walking, headaches, burning in the mouth, salivation, high heart rate, and dilated pupils, followed by central nervous system depression, low heart rate, and paralysis.
Coniine is sometimes used for homeopathic treatments, though it's a dangerous practice. The ancient Greeks used it to treat joint pain and spasmodic conditions, but they also used it in executions, famously in the case of Socrates. In modern times, it's usually a plant that is destroyed or avoided, a constant concern for poisoning of livestock, small animals, and unfortunately, foraging humans.
Coniine acts as a competitive antagonist of the acetylcholine receptors in muscle, similar to the way curare does, blocking acetylcholine from attaching to its receptor. It also has some effects on the autonomic nervous system that controls heart rate, digestion, and other automatic functions in the body that we don't regulate voluntarily.
This results in all sorts of unpleasantness for your victim, ultimately causing an ascending paralysis leading to asphyxiation.
I find your lack of faith disturbing.
So, how could Coniine or something like it fit into your story?
Imagine you have a space explorer who's decided to stop on a habitable world to replenish his water and food supplies. His ship's scanners are pretty good, and they detect a glucose source in a peculiar forest on the planet's surface. He lands his ship on a huge plant, with leaves that can support its weight, right next to a steep drop into the depths of the plant's main structure. He exits his ship, noting the atmosphere is nearly perfect. Taking the risk, he removes his helmet and inhales deeply. Nothing happens, so he takes a few steps. The leaves are sticky with sugar, and his gloves come away covered with the nectar when he kneels down and touches it. After such a long trip, he decides he'll treat himself to a little sample, throwing caution to the wind.
Initially, it tastes wonderful, so he has a little more, then a lot more, finding he can't stop himself. Before long, he's dizzy, so he decides to get back to his ship. But he falls. He can't walk. He vomits, noting his mouth burns afterward. Then he feels heavy, starting in his legs, then his trunk, and even up to his neck. His breathing becomes labored. Finally, he collapses, fully aware he can no longer draw breath, as he slowly slides towards the plant's central cavity and plummets into its dark depths.
Our space explorer went from enjoying a sugar rush to becoming the unfortunate meal for a carnivorous plant. Notice too the ascending nature of the paralysis, moving slowly upwards from his legs before it finally interferes with his respiratory drive, leading to his demise. Tetrodotoxin is an incredibly potent neurotoxin produced by lower marine organisms, which is concentrated and can be found in pufferfish, certain frogs, salamanders, newts, gastropods, and an Australian octopus species.
In the case of pufferfish, the animal can still be eaten, but only after it has been carefully prepared in a way that removes the toxic organs of the fish. In Japan, where this fish is considered a delicacy, the person preparing the fish must have a special license that can take many years to obtain. Poisonings occur from time to time when unlicensed practitioners try to get by without the training.
Tetrodotoxin blocks sodium from entering nerves, preventing them from sending the signal to a muscle that it needs to contract.
Poisonings happen most often after ingesting an organism that has concentrated tetrodotoxin in its organs, rapidly causing dangerous and uncomfortable symptoms.
Lower doses cause numbness and tingling around the mouth, fingers, and toes, and weakened reflexes. Higher doses can cause nausea, vomiting, ataxia, weakness, dizziness, low blood pressure, and paralysis. All of this happens with a usually conscious victim.
If a victim of this poisoning were to come into the ER, acetylcholinesterase blockers, sort of like physostigmine mentioned in the Curare example, may have a role in helping to reverse the paralytic effects, but respiratory support and blood pressure support are paramount.
How could tetrodotoxin or something like it fit into your story?
A sailing ship's captain is far from home on an expedition to discover new trade routes and secure alliances with natives in the Pacific Ocean. But the captain is strayed from his mission, instead exploiting the local peoples. He and his crew abuse the poor natives, and in one instance, a local cook has been kidnapped and forced to serve the captain on his travels. The cook is a natural at unlocking the innate qualities of taste from fish and other seafood with only a minimum of spices and supplies. In return, since he would never pay the man, the captain has agreed to let the cook keep his wife on board. But the wife is attractive to the captain, and he can put aside his urges no longer. He tells the cook he will have his wife, and the cook will either do nothing or be killed.
The cook agrees under minimum protest, but he insists that he alone knows how to satisfy her needs. The secret is to eat the testicles of a certain fish, one that will not only be delicious, but also provide a potent aphrodisiac. The captain thinks it's an excellent idea, but he'll only eat it if the cook prepares it right in front of him in his cabin. The cook again agrees, having nothing to hide, and selects a prime specimen. He opens up the fish and harvests the testicles, preparing them carefully in order to bring out the flavor. The cook even takes a bite of meat himself, proving it must be safe to eat. Once provided a testicle, the captain tries it, savoring the best thing he's eaten in years, when suddenly he begins to feel tingles in his hands and feet. "That's how you know it's working," says the cook. "Can't you feel the tingle on your lips?" he asks. Indeed, the captain can.
So, he eats up even more. But then he tries to stand and falls beside his table. He is weak and nauseated. Adding insult to his developing injuries, the cook comes to his side with a smile, and the captain can do nothing to rise. As breathing becomes more and more difficult, and the captain feels himself fade, the cook has one last thing to say. He tells him the truth. After enjoying the pleasure of watching him die, he will go straight to his wife and prove his love to her, completely fulfilling her every need.
Our savvy chef knew that the testicles are a location where tetrodotoxin is most concentrated. He only sampled a small amount, so the side effects to him were minimal. Whether accidental or intentional, if tetrodotoxin is part of dinner, don't bother saving room for dessert.
Botulinum toxin is another formidable neurotoxin, but this one is produced by the spore-forming bacteria Clostridium botulinum.
It can be preformed in the bacterial environment, such as in improperly stored food specimens, or produced inside the victim's body after the bacteria have been introduced. Poisonings occur around the world, but often they occur where people are producing homemade foods such as tofu, canned vegetables and preservatives, or aged fish. Events have also occurred from infections, such as sinus infections, and from deep penetrating wounds like those sustained in surgery or traumas. The toxin also has an unfortunate role for illegal use in bioterrorism.
Botulinum toxin works by interfering with the release of acetylcholine, that messenger molecule that crosses from the nerve to a muscle, usually signaling for it to contract. So far, we've used examples of toxins that get in the way of acetylcholine finding its receptor, but botulinum toxin nips acetylcholine in the bud, stopping it from ever setting out.
This leads to a descending paralysis, equal in how it affects the organs on both sides of the body, eventually resulting in respiratory paralysis and asphyxiation.
Even worse, the effects are found at nerve terminals in multiple systems, affecting more than just voluntary muscle movement. Cranial nerves are affected, leading to vision problems, trouble speaking, and trouble swallowing. Constipation and urinary retention can happen as well.
And unlike the other toxins we've discussed, this binding process is irreversible. New binding sites must be made by the nerve terminals, which can take anywhere from weeks to months.
In the case of toxin exposures on purpose, such as Botox injections for wrinkles, this is a good thing. For a victim with full body paralysis, the recovery will be much harder. Fortunately, there's an antitoxin derived as an antibody harvested from the blood of donor animals that can mitigate the process as it develops, but it can't reverse the paralysis.
So how could botulinum toxin or something like it fit into your story?
A pair of drug runners are speeding through the desert, truck loaded down with bags of cocaine. They've had a hell of a time avoiding the law, and other hustlers have been less than kind. In their hurry, a depression in the terrain causes the truck to bounce, and a few of the bags fly out of the bed. The bags are damaged, and the drugs inside have been contaminated by desert soil. Knowing they'll have to cover the cost of any drugs they lose in transit, the runners decide to repair the bags and keep the cocaine, even if it's not the cleanest thing they've ever done.
They continue on, but they're ambushed at a checkpoint and detained by a hotshot sheriff's deputy. He decides to arrest them, but only after they've shared the location of their nearest hideout. They agree to take him there, a journey lasting several days. Along the way, the runners notice the deputy begins to look unwell. He has fever, complains of severe headache, and has terrible facial pain. At the hideout, he raids their stash and finds their money, collecting it all in the name of the law. On the way back to civilization, he continues to look worse and worse, but he keeps them under guard well enough and eventually brings them in.
They face their time in court, and it looks like the judge will throw the book at them. But enter the defense attorney. He wonders where the sheriff's deputy is that brought his clients in. The judge says he's in the hospital. But the defense attorney is well aware. Paralyzed, he asks. On a ventilator? The judge is astounded. How could he know? Because he was able to get a sample of the cocaine confiscated from the drug runners on a hunch. The samples contain Clostridium spores, introduced to the cocaine from the desert soil. The attorney lays out his case, detailing how the sheriff's deputy developed a sinus infection on the road, and how this infection led to a descending paralysis and eventually respiratory failure.
The judge grows uncomfortable. He knows it's all true. He's eventually forced to throw out the deputy's testimony and release the drug runners. How did you do it? Asked the astounded would-be felons. Elementary, my dear ne'er-do-wells. Because the botulism toxidrome the sheriff's deputy suffered could only have been inflicted upon him if he snorted your cocaine. And so, the ace attorney wins again.
So the sheriff's deputy sampled the contraband and got much more than he bargained for. His short-lived high earned him likely weeks to months on a ventilator in the ICU. Talk about learning a lesson the hard way.
Alright guys, this has been a brief sampling of drugs and toxins that can cause paralysis, but it's by no means meant to be an exhaustive list.
The historical use and discovery of poisons and life-saving medication is interesting and ongoing. So if you're still curious about this topic and want to see a follow-up video in the future, let us know in the comments.
I'm something of a scientist myself.
As we've mentioned, our goal with this series is to share real-life knowledge to help suspend disbelief and have your readers dive even deeper into your stories. If you laughed or were horrified along the way, well, that's just a bonus for us.
And if any of you fellow writers or readers have questions, we hope to hear from you.
If you found this topic helpful, interesting, or at the very least entertaining, be sure to like, subscribe, hit the bell icon for notifications so you don't miss any of the breathtaking, heart-stopping ways for how to kill your characters.
Bye.